Hi everyone, and welcome back to this unique S.P.C therapy session where you can expect to see manual therapy, wet cupping therapy, as well as massage. So the therapist is going through some active movements here with the patient, asking the patient to do the movement themselves so you can look at the quality and quantity of the movement. He's focusing on the wrist here because the patient is feeling a lot of tightness on the forearms, which has affected the movements which are coming from the wrist joint. So you're looking at flexion, extension, ulnar and radial deviation here. Now you can see that the therapist is going to be performing some massage on the extensor compartment. So this is looking at the muscles which involve an extension of the wrist, the arm, as well as the fingers. And then he's going to be moving on to the flexor compartment. So these are the muscles that are involved in flexion of those areas. So he's really looking to relax the muscles. He's looking to kind of flush away any kind of toxins, to get new fresh blood into the area, improve circulation, and just really trying to get rid of any tension of the muscle. He's going to be also, the therapist, you can see that he's kind of focusing on a muscle at a time, and he's trying to divide some of the muscles and trying to single out those certain muscles and just do his massage on them. He has cleaned the area to get the patient ready for manual therapy, and you can see that he's trying to improve the movements or the range of movement that's available on the wrist joint or from the wrist joint, and he has stabilized the forearm whilst he's trying to mobilize the wrist, and he's doing different kind of movements, and he's just really trying to improve the range of movement here. And if there's any kind of stiffness which may have caused the pain, this can be improved via these movements. Now you can see that he's forcing some extension, and there was a little bit of tightness here, so he's just trying to really improve some of the movements here. So you can see here now that the therapist is moving on to wet cupping therapy, but he's really looking at the anatomy, thinking about the different muscle bellies, because he's just trying to focus on putting the cups on different muscles and really trying to make his session effective. So now we're going to start with incisions, and the cup there, which you can see being removed, that's where the incision is going to be happening now, and you can see the incisions are being made, and they don't hurt, by the way. It's like a scratching sort of sensation. Once the incisions are made or done, the cups are placed back on top of the area, and again a few pumps or suctions are made to basically help to get that blood out. So once it's been left for about 5 to 7 minutes, you can see the cups are being lifted, and that's what comes out of it. Sometimes there isn't much that comes out of it, but the theory is that the blood that does come out, it's meant to be carrying toxins, lactic acid, these kind of things, basically bad blood, which your body needs to get rid of, and your lymphatic drainage system does it in the body already, but through cupping we can try and help that.